Women with plenty of estrogen don't have depression. And this has to be the biggest message. When women have plenty of estrogen, they just don't have depression. It doesn't exist. Welcome to the MeNoPause Moxie podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm clinical hormone coach Marie Hoäg, and today we're launching a new monthly series on the MeNoPause Moxie podcast called the Clinical Indicator Series. Each month, we'll examine one of the top 50 symptoms of hormone deficiency that women commonly complain about, and we'll explore what that symptom is actually indicating clinically and what you can do about it. The series is about education and solutions and understanding what the female body is communicating when hormones are no longer sufficient. We're starting this series with depression, not because it's rare, but because it's common, misunderstood, and often mistreated. To help guide this first clinical indicator conversation, I'm joined by my co-host and producer, Maggie Kuhn. Hey, Maggie.
Hey, Marie. I am very, very much looking forward to this episode because this topic for me, and I know for you and many of our listeners, so this has been a really big eye-opener, I think, and game changer. When women hear the word depression, Marie, they usually think of it as a mental health diagnosis. But from your expert clinical hormone perspective, how do you define depression?
Well, I have to tell you, I'm not a physician, but it's very difficult to not see what a person sees when a woman gets enough estrogen. And I'm talking about from a clinical perspective. The thing that gets me excited about depression and hormone balancing and estrogen is because of the impact estrogen has on a woman. So I would have to define depression as being more of a side effect of estrogen deficiency. I know conventional medicine depression is a neurological disorder, or it's a chemical imbalance, or we're told it's hereditary. And those are all the same things that I've been told too. And many women, come into the clinic saying, my doctor told me that because my mother was depressed, I would be depressed. They really don't know that it could be something caused by estrogen deficiency.
Well, maybe you are depressed because your mother was depressed because you're both estrogen deficient.
Yeah. And that's what ends up happening is when women get enough estrogen and they realize that the only thing that they did differently was take estrogen, that they no longer have depression. And then they look, well, my mother had a hysterectomy, or my mother was hormonally out of balance and she had depression. Could this really be a transgenerational issue? And that's, part of my current research right now is this transgenerational inheritance of these symptoms that women are told that they have to live with. And so clinically, I see women typically don't experience depression when they have plenty of estrogen. And this was really eye-opening for me. And actually, this was the thing, Maggie, that part of me couldn't believe what I was actually witnessing clinically when patients kept saying, well, I no longer have depression. I no longer have depression. And though I was feeling the same thing, I just couldn't believe it because I'd spent so many years told that this was a neurological disorder, that it was a brain issue, it was a hereditary issue, and so I just couldn't believe that I wasn't experiencing depression. And then these women saying the same thing. So yeah, it's hard for me to talk about depression without also talking at the same time about estrogen deficiency. Because when a woman's brain is saturated with estrogen, she just doesn't have depression. It's just not a thing. And this is one of those things that I encourage doctors and other people to challenge me on. When estrogen's maintained in a particular clinical blood range, women just don't have depression. And it's part of the research that I believe that we need to have. We can't keep this information. We need to know at what point, how much estrogen does a woman need that can clear up her depression. And these are the studies I believe that we need, Maggie, more than anything.
Yeah. Before we get too deep into talking about hormones and estrogen, What assumptions are being made when a woman is told she's depressed?
Well, that she's mentally ill. I mean, it's a bittersweet experience for a woman. It's like, why, oh, finally somebody listens to me. Somebody understands how I'm feeling. I have a clinical diagnosis. I'm not just complaining for nothing. I can go back to my friends and family and tell them, see, there's something really wrong with me. This is why I feel miserable. This is why you can't hold me accountable to anything. This is why you can't expect me to do what everybody else does, because I have this diagnosis. I have mental illness. And I tell you something, when a woman has that label, it changes who she is. It really takes her out of her own skin almost. And she just doesn't it she gets detached with her inner being, because she's no longer communicating like she should with her inner being. She's now listening to other people tell her that she has this mental illness. But also, one of the biggest problems is she's put on psychotropic drugs, and it completely changes who a woman is.
Yeah, I mean, I would think that for most women, sure, a mental health diagnosis of depression might help explain some things, but it can also feel like a life sentence, because if I'm depressed now, I'm likely always going to be depressed. It sort of feels like now this condition is something to be managed and may ruin someone's life. That's how it would land for
Or
me.
that, yeah, and like a woman, oh, you have to adapt, that you have to, this is your future, this is your life. I mean, I
Yeah, life's
remember,
kind of over now.
oh
Um,
yeah, I had two babies under 3 when I heard this, and I was like, wait, what?
yeah.
And so, shock therapy was my next course of treatment, because the psychotropic drug stopped working. And
Wow.
that was horrible. I mean, I when a woman is diagnosed with depression and is told that, well, we can manage this, it's something you'll have the rest of your life. The doctor doesn't say, oh, this is temporary. Oh, you're probably going to have it forever. Here, take this medication. And then the woman takes the psychotropic drugs. It changes who she is, turns into a shell of a woman. Then she adapts into being somebody that she never really is. It's such a lonely place for a woman.
Hmm.
You
What do
know,
you
it's
think
what
is getting, Marie, what do you think is getting missed when depression is framed as a psychological issue instead of a physiological one?
the true problem. You can't address a problem that you don't acknowledge. Women with plenty of estrogen don't have depression. And this has to be the biggest message. It's when women have plenty of estrogen, they just don't have depression. It doesn't exist. When I first heard this, I didn't believe it. I really didn't believe it. And, everybody else was talking about my mental illness was something that I had to have, that I had to manage the rest of my life. And what gets missed is the opportunity to restore hormones for women, of getting to the root cause of the deficiency, of what's causing the depression. So I would have to say that about 85 to 95% of the depression that women experience is directly related to a hormone deficiency induced depression, more notably estrogen deficiency. It's just like I mentioned, it's just rare for women with plenty of blood estrogen to have depression. It just doesn't exist. It's such a sure thing, like black and white, something so dependable. And I remember I had a hard time in the beginning clinically when we were discovering this. I wasn't so quick. The other practitioners on the team, they were like, "Oh yeah, patient, when we get those estrogen levels up in a certain range, the patient won't be depressed any longer." And I remember listening to this with these practitioners over and over. And I'm like, why are you so sure? How are you so sure? How do you know this patient? And then there was a point where I think because there were physicians, and they've been in the medical industry a lot longer than me, or they were just certain. And even though I saw this over and over and over, how do you know with certainty? How can you say that with a full throat, that you're telling a patient that they will no longer be depressed? How can you say that? You can't do that in medicine. And then after a while, I'm just like, okay, yeah, when we restore your hormones, if you get depressed, it would be very rare. And we would want to know why. We would
Yeah.
dig in other areas. But this is how much estrogen affects a woman's ability to be depressed.
I think this is one of those mind shifts that we are asking our listeners to consider. We've talked about other mind shifts like you can prevent menopause or you can prevent perimenopause. This is another one. You do not need to have depression. Depression is not a foregone conclusion. Very likely, if you are a woman, especially a woman of a certain age, but we're going to talk about this in a few minutes, that it's not always just age related, but particularly if you are a woman in middle age and you suddenly have depression, it is very likely a hormone deficiency. Is that what I'm hearing you say?
Oh, yes. I mean, there are women that can live their lives without depression, but they can be susceptible to it when their estrogen begins to decline in stage 1 perimenopause. And so women who have never had depression before are all of a sudden experiencing depression. They're like, what's going on? Everything else I used to try worked for me, and now nothing is working. How is that possible? And the women who have had horrible, horrible menstrual cycles throughout their life, by the time they reach stage 1 perimenopause, their depression is so bad that these women are typically on quite a cocktail of psychotropic drugs. And they've spent years managing their symptoms of, well, estrogen deficiency. And that when women finally realize that all the years they've spent taking these psychotropic drugs and all the side effects of the psychotropic drugs and the side effects of those medications to manage those side effects, it's like then they realize they didn't even need that at all. They go through that angry period that I mentioned so often, that when women realize all they needed all along was estrogen and that this was nothing but a pharmaceutical game, I mean, there will be a time, there will be a day of reckoning when women will realize that they have been had and they have been lied to about this whole depression thing. Because I can say with confidence. So when women tell me they're depressed, the first thing when I hear them, when they say, oh, I'm depressed, the first thing that comes to mind is you're not depressed. You're just low in estrogen. Because no woman with plenty of estrogen is depressed. It just doesn't happen. It doesn't happen. Not even when it should. Not even when things would trigger depression. And that's what it was like for me and a lot of women. It's like, oh, something happened that would normally trigger my depression. I would normally go on medication. And now I don't. I mean, this thing happened. I'm handling it. That's weird. I'm not going crazy. That's weird. I'm not depressed. That's weird. I'm not having anxiety about the whole thing. That's weird. I'm actually sleeping through the night in spite of all this. That's weird. I mean, it's like, this is a part of what women go through when they get their hormones fully restored through the process, through the 3 phases that we talk about quite a bit on the show. And the more
I think that there's, and again, this is the mind shift, because there is such an ingrained belief and narrative in our culture and society, because it's so common that women, life piles on and piles on and piles on. And at some point, the bottom just drops out. And we assume it is because life has just piled on, and that this is the natural outcome of that happening. And that depression is often part of the soup of where the floor drops out. The other narrative is that depression is biochemical. It's in the brain, and it is, but it may not be caused by what we think it is. And it's not just the brain. And we're going to talk about that too in a minute. But those two narratives are so strong. And I don't necessarily think that they're strong out of something nefarious. It has been what has been understood up to this point. But you have been a clinical hormone coach for more than a couple of decades, and you have seen over and over again in both patients and yourself that when a woman has plenty of estrogen, not only does the bottom not drop out, depression goes away, and a woman has better ability to manage life and be resilient to things that would normally tank her. So, I mean, this is big.
totally, it really is. And then you have to ask yourself, if it's so dang big, then why isn't everybody doing it? And then
Yeah,
that's the big controversy. And, why are
right.
we keeping these women depressed? Why are we telling women that this is just something that's in their head? Yes, it is a biochemical imbalance, but that imbalance is the deficiency. It's estrogen deficiency. Estrogen is responsible for neurotransmitter activity. Estrogen is responsible for serotonin levels, dopamine. I mean, estrogen is responsible for how a woman feels about herself. It's responsible for a woman's self-esteem, her self-worth. her will to live. I mean, it is like clockwork. It's like night and day. In fact, when I tell a woman, could you imagine? I mean, really, even the listeners, imagine what your life would be like if you didn't have to worry about ever being depressed. If like depression was just removed out of your life, what would your life be like? And it's strange for when women get enough estrogen and they're not experiencing depression. It's almost like they don't even know how to live because they're like, okay, so what is this now? They don't even know how to behave because they're so busy managing their behavior and their depression that they don't even know how to just naturally flow with life because they're so busy trying to manage the depression and the flow.
Yeah. So you
So,
just really helped explain the estrogen brain connection. Of course, one of the big revolutions in mental health, in at least the last decade or so, has been the gut brain connection. But there's also a gut brain connection that's related to estrogen, right?
oh, yes. I mean, gut health is super critical in depression in women. It's not just about estrogen, but estrogen's also responsible for gut health and gut health metabolism and estrogen metabolism. And if the gut isn't working well due to low estrogen or due to dysbiosis, high processed food diet, then women will get depressed. The two main factors of depression in women are gut health and estrogen. But the gut does not work well, and women will be susceptible to gut dysbiosis if estrogen is deficient. So, estrogen absolutely influences all, it influences everything that contributes to a woman's depression. So, like I said, from gut health to situational, environmental situations that would cause a woman to be under more anxiety and stress, and that can cause a level of depression, but also that influences estrogen production. So, what it really does come down to is estrogen levels.
Hmm.
When women have enough estrogen, they're able to cope, like you mentioned, they're able to cope and handle the things that come their way, and they're less likely to be depressed. That depression is such a cloud. It is a heavy, dark cloud that gets in the way of decision making. It gets in the way of living. It gets in the way of a woman driving through her own life. And it's just, if you can just remove the fog of depression, it just allows a woman to take control of her own life, her own brain, her own situations, so she can actually communicate with people and loved ones without this dark cloud of depression. So when I
Yeah.
hear women, when they tell me I'm depressed, I hear a woman who's just lost and just begging for the juice of life. And that's what I mean, I call estrogen that quite a bit. Estrogen is the juice of life on so
Yeah.
many levels.
So I want to clarify that we're not necessarily saying that the entire mental health field will go away if women get enough estrogen. What it means is that if women get enough estrogen, perhaps their depression will clear up, and then the mental health experts can work with them on all the other issues that they still need to deal with in life. But they'll have the bandwidth to now do it, and this major block will have been removed, and you can actually get to doing some real work on yourself, as if you're the patient or as a clinician, on helping somebody really live the life they want to live.
Yeah, it's almost like I want to remove the term mental illness out of this whole healing thing. It's like it's such a horrible stigma, just the term. If we can look at women's depression as a way, because a lot of women don't deal with their stuff because they're so depressed, they're so estrogen deficient, they can't cope. I mean, estrogen deficiency contributes to so many other things in addition to depression. But if you can give women enough estrogen so they're not depressed and they can cope and deal with their life, then whatever issues, psychological issues that have developed over the years through whether it's childhood trauma or what have you, then you can work on something such as cognitive behavioral therapy. So it's like, okay, let's deal with the systemic problem. Let's deal with the deficiency disorder. Let's give the patient enough hormones so she can actually work on her problems through cognitive behavioral therapy, which is, I think, is just a wonderful tool for women. So if you can actually just leave mental illness out of this whole picture, because okay, well, let's just restore your hormones so your brain is working, so you can, enhance your coping skills. you can enhance your brain, your problem solving skills, your executive function, your self-worth, your self-esteem, your self-reliance, your self-dependence, all these things. And then now we can work through your problems. Yeah, this happened to you. That sucked? That's too bad. Let's, how could that have been handled differently? How does that really affect you? And then women can work through those things a lot better than this heavy cloud. Oh, I'm depressed. I can't think of anything positive. It's just such a great combination if women want to work through their childhood trauma, is get plenty of estrogen circulating in your blood and find a good cognitive behavioral therapist and get to the other side. These two tools are such a great healing agent for women to get on the other side of their mental illness.
So often a primary care physician or general practitioner a woman will come in, say she's depressed. He or she will put them on an SSRI, an antidepressant. But why do antidepressants often fail when estrogen is low?
Well, because the root cause isn't being addressed. People don't have a Prozac deficiency. They have an estrogen deficiency. One of my mentors used to say that all the time. Antidepressants don't address the root cause. That's why we have to address the root cause. Otherwise, women are just on this exercise wheel of managing the symptoms of hormone deficiency, estrogen deficiency, such as depression. So if you give a woman estrogen and she no longer has depression, then there's no need for psychotropic drugs. There's no need for treatment, shock therapy, and those types of things.
Right.
So then,
I've also heard you say that SSRIs don't replace estrogen's metabolic and regulatory roles.
No, they
And
make women,
that's part of the
numb.
problem.
Yeah, they turn women into just shells of who they are. They make them numb. They make them emotionally detached. So women have a very difficult time attaching to people or emotionally connecting to people on a healthy level. Their children, their significant other, their friends, their coworkers. So women are just really walking around just shells, like Stepford wives, who just really have no direction whatsoever. They're just living, they're just existing. And so, yeah, it's, what kind of life is that? I mean, that was my life. And that actually is, a lot of women experience that.
Yeah. You kind of just went over some of this, but in your clinical work, how does estrogen deficiency depression typically show up?
It's actually one of the first things that shows up is depression. So when we get hormones fully restored and get patients in their hormone sweet spot, the goal is to manage this optimal hormone homeostasis. But every once in a while, something will come along in a woman's life that will bump her hormones out of the sweet spot. And one of the first ways that we teach patients is one of the first things we teach patients is to understand if your hormones are out of balance is if you feel any sense of depression, any sense, a twinge, if you find yourself depressed, going to bed depressed, waking up depressed, not feeling like it's as little as that, Maggie. It's as little as that. That is the indicator. If you're not yourself, if something's not going on. So usually I won't talk to a patient for a while when they're hormonally balanced. The goal is to give the patient enough information and hormonal balance that they don't need me. But as I mentioned, hormones can become out of balance if the requirement for estrogen is more than what the patient has circulating in their blood. And so they'll contact me and they'll say, something's not right. Something's not right. I'm usually depression is accompanied by other symptoms such as anxiety and insomnia. And so they're usually presenting with those symptoms too. And then I just say, let's check your hormones. And so we check a handful of labs and usually we'll see a change in estrogen. There's rarely is there a time that estrogen is an influence. So the patient's symptoms, and that's why monitoring the clinical indicators is so important, because the clinical indicators will show up even long before blood work. And so what we get is more of we suspect that your hormones are tanking for some reason. Then usually when I talk to the patient a little bit, they'll say, this is going on and this is going on. So something will make sense of the drop in estrogen. And then we confirm that with blood test. And so, as you know, we take a clinical indicator assessment within an hour of a person getting their blood drawn, because estrogen works in real time. And so we measure clinical indicators with estrogen levels. And so when we get that blood work back, it's like, oh, okay, what's going on? So your estrogen's dropped. Why did your estrogen drop? There have been no changes, or there have been changes. So then we just make what we consider a phase 2 reassessment. And then we readjust the hormones or change the protocol to get the patient back into the hormone sweet spot. And then the depression resolves, the anxiety resolves, and all the negative clinical indicators resolve. The clinical indicators tell a woman where her hormone levels are. This is why it's so important for women to pay attention to how they feel. If you're depressed, if you have anxiety and you're going to the doctor and they're just gaslighting you or dismissing you, then they don't have a clue estrogen's impact on a woman. It's just, that should be the first thing when a patient comes in to say, I'm depressed. First thing, let's check your estrogen. That should be first line therapy for every patient.
Yeah. Well, and what you've just been describing is women who've had their hormones balanced and they know what that feels like. And then if they start to feel off, the clinical indicators, negative clinical indicators start coming back again, like depression, anxiety. They know that likely their estrogen in particular has taken a dip due to some extraneous circumstance, perhaps. But what we're also talking about is women who have never had their hormones balanced and they are empty tank. They're walking around saying things like, I don't care like I used to. Everything feels heavier. I'm functioning, but I'm not living. You know, these are the types of things that I'll
This
read.
is my life.
Yeah.
Woe is
This is
me.
just what's happened. That, I've had all the kids, it's life's so stressful. And it's just taken as a foregone conclusion that this is just part of life. And yet I do see on a lot of these menopause discussion forums, women are raising the fact that they're really depressed and they're asking, is this a symptom of menopause? And of course, we talk about the fact that there are no symptoms of menopause. Menopause is a symptom of low estrogen. But the point being that women are questioning, does this have something to do with where things are at, the stage of life that I'm at? Let me ask you this question. Is this something that only happens to women in the menopause time frame, or can this happen at any time?
Maggie, this is how everybody should look at this whole thing. PMS, perimenopause, and menopause are PMDD. Let's see, we can even add PMDD, PMS, PMDD, perimenopause, and menopause. 4 conditions, 1 cause. Once women realize that estrogen impacts them from head to toe and their menstrual cycle quality will tell them if they have enough estrogen or not, they get very disgruntled at the fact that they've been given the runaround this whole time. This is also how we know how long women have been hormonally deficient. Women need to understand that their menstrual cycle quality is directly related to their estrogen levels. And so it's so important for women to understand estrogen.
So the fact that a woman is depressed, but she's not, technically in menopause, it can still be an estrogen deficiency, is what you're saying.
Women don't get depressed typically unless they're low in estrogen, and it can happen at any age, at any time. It can happen when women are 12, 18, 23. I mean, you name it. It doesn't matter how old a woman is. Anytime estrogen is deficient, about 95% of the women will experience depression to varying degrees, depending on how long a woman is deficient and how long she remains deficient. And this is why women who have had PMS, PMDD at a young age, and these women have these are the women I really feel for, because they have spent the majority of their lives being gaslit, who have been put on birth control pills and antidepressants and are told this is how it's done, and have lived years and years and years in chemical menopause, because as you know, those birth control pills shut down the signaling to the ovaries and shuts down estrogen production. So women don't have the protection of estrogen, so they get depressed. So that's why you see read the package insert of the oral hormonal contraception. that depression is one of the side effects of oral contraception because it shuts down ovarian production. It shuts the estrogen down. So, and the reason I'm just so adamant about this is because it's one of the first things that goes away. Like I'm very careful to, well, I get excited to tell women that they'll never be depressed again, but yet it sounds too good to be true. So it depends on the patient. If the patient is extremely depressed, I've learned to manage my excitement knowing that she's not going to be depressed until she's actually experiencing it. Because women will get a whole level of anxiety, worried that they'll be the only one who doesn't get their depression resolved from restoring estrogen. So usually women will experience this depression-free life within about an hour or so of starting therapeutic dose estrogen.
I mean, that's extraordinary. I hope that that really sinks in for people who are listening to this. That is
Yeah.
extraordinary.
And
And
it sounds too good to be true. And people, how could you say that? How could you say that? Well, you know what? I can say that with a very clear conscience and a straight face. And I challenge doctors and I challenge women to see for yourself. Boy, when women get a good dose of estrogen, it just clears that right up, and they don't even really know who they are, and it makes them feel a little bit awkward in the moment because there's a lot of women who've never lived a day of their life without depression. So having this a day or an hour, this time without depression, it's like, what the hell? It's like, what? It seems so unreal, and then at the same time, there'll be a level of anxiety of, when is the other shoe going to fall? How
yeah,
long is this going to last? Because it never lasts, it never lasts, it never lasts. And then day after day after day after day after day. And it's like, then after a while, like me, you just kind of concede to the fact, it's like, oh, I guess I'm never going to be depressed again. This is nice.
mhm.
I mean, it's like,
What do you think is, in your experience, what tends to surprise women the most when they realize their depression has a hormonal root?
how easy it was to get rid of. How easy. Oh, estrogen. Oh, give me a good dose. Wow, that was crazy. Like, oh, wow. I mean, just the fact that, and then they get angry because all the things that they've been told all along, take this, you're mentally ill, you have mental illness, you know, stay strong, all these little memes that they now live by because they can't cope. And then there's anger. Like I mentioned, there's always anger when women realize, oh, is this all I needed all along? Really, really, my life would have been so different if I would have had estrogen from the get-go. These are all very common things. And then
Mhm.
women get worried that, what if this doesn't last? What if it doesn't last? I can't remember how long. I can't remember feeling this good. How long is this going to last? Yeah. And
Yeah.
then after a while, it's something. Women can adapt to feeling good every day for no real good reason. It's very mood stabilizing to a woman's life. It's stabilizing to her family. It's stabilizing to her career, her job. It's very, not having depression is a very stabilizing experience in a woman's life.
Yeah, absolutely. So, why do you think that depression is almost never evaluated through a hormone lens?
Money. There's a lot of money to be made off of women suffering. Boy, I mean, really look at this. If you were, you know, an evil ruler, and if you wanted to control just people, first thing you would do is you would withhold estrogen from all the women, and you would make them depressed. That would make them detached from their loved ones. So they'd stop caring about their loved ones, and they would stop caring about themselves. And they would have headaches and depression and anxiety and insomnia. And they would be susceptible to the symptoms of estrogen deficiency that's been clearly documented in the National Library of Medicine. I mean, there's no secret on what estrogen does for a woman.
Hmm.
And if you just withhold that from her, and then now she's riddled with all of these conditions, these mental illness, physical malfunction, and decline and deterioration. Well, you can control people real well this way. Now you can sell them products to manage the symptoms that have been induced by hormone deficiency. And this
Yeah.
is really what the model has been set up. starting with the FDA food pyramid, eat these foods. And then that messes up the gut microbiome, the processed foods, that shuts down the ovaries, that shuts down the estrogen production. And women are now, depressed. They go to the doctor, they're put on antidepressants. Oh, you have depression. Now they are riddled with these mental illness diagnoses that are now managed with pharmaceutical drugs. And so, yeah, there's a lot of money to be made by convincing women that, oh, menopause is it's a life stage. All women have to go through it. It's inevitable. No, it's not. We used to address menopause as a deficiency disease years ago.
Mm.
You know,
It's somehow like we also, have forgotten some of this knowledge that we once had, which I think does happen. And I think that may be partially because of medical silos. Medicine seems to be so specialized that one is not talking to the other to figure out that these two things might be related. And instead of that, they're in their silos and they get all their drugs and whatnot that relate to their silo, but nobody's connecting the dots, or very few are. And
I mean, if
fortunately, enough doctors and clinicians are that women are starting to, get real solutions with hormone replacement therapy.
Yeah, but as you know, Maggie, these doctors are offered no training in HRT. And if they do seek out training in HRT, they're only offered low dose therapies,
Right.
protocols designed to keep a woman's hormone tank about a third full. That's it. Women
Right.
need their hormone tank completely filled up for their brain and body to work right, to get rid of these mental illness diagnoses that women are told that they have to live with. And this is just a real crime, in my opinion. I mean, the years of suffering that women go through because we don't address depression as the estrogen deficiency condition that it is. And I challenge physicians, really, if you don't believe me, see for yourself. Give women enough estrogen until they stop asking for it, and you'll see they will no longer have depression. They'll no longer have these symptoms that you've been taught in medical school to manage with psychotropic drugs and other pharmaceuticals. It's a whole different world when you address depression and mental illness at the root cause of hormone deficiencies. In fact, most mental illness deficiencies that women have are directly related to hormone deficiency, most notably estrogen deficiency. And this is the thing that I think that's the most important message women should understand and physicians should understand. I mean, physicians that are listening to this, are you a physician that keeps estrogen low and keeps women in a state of hormone deficiency so she's still experiencing depression? Consider fully restoring her empty hormone tank until the depression is gone. That's how you know a woman has enough estrogen or not, is if she has depression. Women with plenty of estrogen do not have depression, hands down, bar none. And it's not a question of if or when it'll work. It's just, it is extremely rare that it doesn't work on a patient. As long as we continue to view depression as a psychiatric condition that needs to be managed with psychotropic drugs, women will continue to just suffer, and their
Yeah.
families will suffer because they don't have their moms and they don't have their wives, and everybody is miserable without mom engaged.
I think there's one other thing we do have to mention, which we have to mention in almost every episode, which is the fear of estrogen that
Mhm.
was created in 2002 with the Women's Health Initiative research that came out claiming that estrogen causes breast cancer. Now, here we are, 20 some years later, scads of women, millions of women have missed out on hormone replacement therapy. A generation of doctors have missed out on training on hormone replacement therapy. And we have a mental health epidemic. So, here these things go together. But of course, what we also know recently is that the FDA has taken the black box warning off of estrogen. And so they're walking that back. It's long been known by anybody who's really cared to look into it that that research was flawed and mistaken, and it created a tremendous scare and disservice to an entire generation of women and their families and the doctors who treat them. So
Mm-hmm.
that is a really big thing that we have to mention here as to how did we get away from using estrogen for women when they show up with depression? Well, that's a big one because doctors were afraid to prescribe it or would only prescribe low dose. So,
And they still are. And there's nothing being offered to them. And, this is my fear, Maggie. And once the FDA and the Menopause Society, sets up those standards for women, they'll only offer low dose therapy. This is why it's so important for women to understand how much estrogen they truly need. It's, standard of care, HRT, does not fill up a woman's empty hormone tank. This is why women who are on HRT still have depression. If a woman's on HRT and has depression, then you know that her hormones aren't fully restored.
Well, you can't get any more clear than that. So what do you want, Marie? What do you want both women and clinicians to take away from this episode in our clinical indicator series?
That we need to address depression as a side effect of estrogen deficiency first-line therapy, first and foremost. That will take care of a lot of problems for women, not with depression, but with other mental illness diagnoses that women are given. Women need to understand, and doctors need to understand, just how much estrogen women need. And women need to find doctors who know how to prescribe HRT that fills their hormone tank up to the brim. And this is where there's a big problem, is we need more physicians to learn how to prescribe estrogen and other hormones that fully restore their empty hormone tanks. Doctors need to be educated in advanced HRT protocols for women. This is what will save women. So if you're a doctor and you want to truly help women with depression, get trained in advanced HRT protocols. You will really be a hero, not only in the woman's life, but in her family's life.
So, Marie, as we continue this series, what should listeners expect to learn about their symptoms that they may have never been told before?
That your symptoms could most likely be a result of your hormone levels. So if you find yourself with anxiety, insomnia, joint pain, depression, headaches, migraines, low energy, fatigue, weight gain, inability to lose weight, well, these are all indicators of estrogen deficiency. You may want to consider getting your estrogen levels checked. This gives women more control, Maggie, over how their brains and bodies function than just about anything else a woman has. Estrogen is the most powerful agent a woman has to control her brain and body.
So if someone wants to figure out what their clinical indicator score is, what can they do?
If you want to know what your clinical indicator score is or how your depression rates, go to hormonebalancetest.com. The hormone balance test is what we use in the clinic that we refer to as a clinical indicator assessment, where you can assess the top 50 symptoms of hormone deficiency, and you can see where you rate. It's best to take the clinical indicator assessment right before you go get your blood drawn, because if you heard in this episode, and you'll hear in many episodes, estrogen works in real time. So if you feel cruddy, if you have depression, then chances are your estrogen is probably in the tank. Thanks so much for joining us today. And remember, everybody benefits when your hormones are balanced. I'm Marie Hoäg, and this is the MeNoPause Moxie podcast.